Cardiopulmonary resuscitation. That's what CPR stands for. Cardio meaning heart, pulmonary meaning lung, and resuscitation, we're trying to revive something, bring it back, keep it going. Right? So cardiopulmonary resuscitation. So that's what CPR stands for. Sometimes people take the class and don't even know what CPR stands for. So you should definitely know the definition of the class you're taking. Okay? So I always look at it is if your roommate is not doing the dishes, then when you have friends over, you have to do the dishes. Right? So you have to compensate for what your roommate's not doing. So the same type of thing in CPR. The heart is not beating, so we're going to beat the heart. The lungs aren't breathing, so we now have to breathe for the person. Okay, so that's our cardiopulmonary resuscitation. All right, this is Annie. Everyone say hi to Annie. She says hi. All right, this is going to be our adult. So remember the ages. The adult was 8 years old and above. Another definition can be puberty and above. So puberty defined as chest hair development in males or underarm hair, or breast development in females, then that would be considered puberty. All right, so we would treat them as an adult. So 8 years old and above. Okay, so CPR is good at doing a couple things. CPR is good because it will apply chest compressions to the chest to squeeze the heart together, right? To pump blood up to the brain and all the way down to the toes to provide oxygen to the body's vital organs. Okay, so CPR is good at that. CPR is also good at preventing brain damage. Okay, because when someone's heart stops, they are clinically dead. So at that 0 minute mark when we can't feel a pulse, their heart has stopped beating effectively to be able to produce a pulse, then that person is clinically dead. But at 4 minutes, that's when their tissue will start to break down. That's called biological death. And so at the 6 minute mark, they will have brain damage. And at the 10 minute mark, they'll have irreversible brain damage. That's at room temperature. When someone's cold, the numbers are a little different, but that's at room temperature. At 10 minutes, they'll have irreversible brain damage. That's why we need to recognize that there's a problem and start circulating the blood that's already in their body, the oxygen that's already inside of their body, all the way around to get the oxygen to the brain to be able to keep the brain alive. So that when the paramedics come and they get everything working better and they bring them to the hospital, get everything working better, the person actually has a good brain and can actually walk out of the hospital. Okay, so CPR is good at keeping the brain alive, and CPR is also good at keeping the heart in a shockable rhythm. We'll talk about that during defibrillation, but ventricular fibrillation is the heart just quivering. But that is a shockable rhythm. It's just quivering, so it's only quivering, and it's not enough to generate a pulse. But that is a rhythm that we can treat with a defibrillator. So CPR is actually good at keeping someone in ventricular fibrillation, that chaotic rhythm, but it is a treatable rhythm. It's good at keeping them in that rhythm so that when we get the defibrillator, right, we're doing CPR, and when we get the defibrillator in place, we put the pads on and make sure no one's touching the person, press a shock button, and then that can clear those charges out, and hopefully the pacemaker will kick in and the person can start to generate a normal pace in their body. So CPR is really good at doing that. Okay, but a lot of people say CPR is not good at bringing somebody back to life. Well, that's actually not what CPR is meant to do, right? CPR is not meant to restart the heart, right? It's not meant to do CPR and a couple compressions like you see on television, 3 compressions and we lost them. Right? I saw that on Criminal Minds the other day. Right? That's not good CPR. CPR is not good at bringing somebody back, but it is good at doing what it's meant to do, which is circulating blood around the body, right? And so we're going to be the heart, and now we are the lungs. So we're compensating for what's not there. Okay, so let's go into the steps of CPR. These steps we're actually going to use on everybody, the adult, child, and the infant. It's the exact same steps. So when you look at it, first thing we're going to do is survey the scene. Make sure that the scene is safe. We're going to tap and shout, shake and shout, hey, wake up, are you okay? Are you okay? We're going to pinch them to see if they're responding to pain. So there's 4 levels of consciousness. Alert, right? And right now you are alert, I'm alert. If you fall below that, then you're only responding to verbal. So that's why we say, hey, are you okay? We're seeing if they respond to our voice. If they're not responding to voice, then they're even more reduced. Maybe they're only responding to pain. So when I pinch them, they flinch, right? That's only responding to pain. And if they're not even responding to pain, then they are unconscious. That's the last level of consciousness. So any time somebody is in a reduced level of consciousness, we need to call 911. Okay, so we'll call 911, we'll point them out and say, hey, you in the blue shirt, go call 911, tell them I have an unresponsive adult and report back to me. Do you understand? And grab that defibrillator. Okay, so the minimum guideline says call 911/activate the emergency response system and get a defibrillator. So 911, defibrillator. So how do you activate the emergency response system? So at the University of Windsor, we dial 911 on a campus phone that actually rings the campus police, and campus police, it's their responsibility to provide first aid for the campus. And they actually work with the emergency response team, right, to be able to provide first aid for the campus, because it really reduces the amount of ambulances that have to come onto campus when there's an emergency response team there and can handle minor things that we don't have to tie up the ambulance system for, so the ambulance can respond to people in the community. But if it's needed, then an ambulance will come on scene. Okay, but that's what we do. We call 911 on a campus phone, and then that will ring to campus police. Campus police will respond and dispatch the emergency response team, which is on campus. And I was on the emergency response team when I was there. I was a training director, so I was responsible for making sure everyone knew how to work all their equipment. Once you made the team, my responsibility was to make sure you know how to check your pack, make sure you know how to take blood sugar and blood pressure, and just to keep up the continuing education for the team. Okay, so that's what we need to do. So we're going to, maybe in your workplace, you might, if a hospital setting, nursing setting, you're going to press a button on the side in the wall and it will say, boom, 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 code blue. Right, and then they'll let you know what room to respond to. All right, so maybe you pick up a radio and actually call back to a dispatcher or something. So however you would activate 911 in your area, maybe just pick up a cell phone and call 911. Right? However you would activate the emergency response system in that area, that's what I want you to do, and get a defibrillator. Okay, so now that we have the help on the way, now we can actually assess the casualties. So far we've just determined they're unresponsive. So the next step is to open up the airway. So one hand on the forehead, 2 fingers underneath the chin, and tilt the head back. And we're going to look, listen, and feel for breathing. We're going to look at the chest. We're going to hear breath hit our cheek, or feel breath hit our cheek, and we're going to hear breath for 5 to 10 seconds, no more than 10 seconds. So we want to always limit our checks to no more than 10 seconds. All right, so we're going to open up the airway and check breathing for 5 to 10 seconds. And we're looking for them to be breathing, right, which is good. But if they're not breathing, maybe they're not breathing at all, or maybe they're not breathing normally. So if they're just gasping for air, that's actually a sign of cardiac arrest. It's called agonal breathing or agonal respiration. So what happens is you just caught this person right before they were about to stop breathing, and so their heart has stopped, their heart is not beating effectively, and the brain's still sending a signal down to the diaphragm saying, breathe, breathe, but wait, where's my oxygen? Where's my oxygen? All of a sudden, the person is just gasping for air, looking like a fish out of water, and all of a sudden, then they'll stop breathing. So you caught them right before they're about to stop breathing. But never mistake breathing abnormally, that fish out of water look, never mistake that for normal breathing. Okay, so we're checking to see if they're breathing, or if they're not breathing or not breathing normally, and that's a sign of cardiac arrest. So then we would start doing compressions. All right, so we're going to do non-stop compressions. Right, we're going to compress forever until people can bring more equipment to us. Right, because you may not have a face shield. So this is a face shield you can just keep on your keychain, and you open it up and put it on their face to breathe. You may not have a pocket mask, okay, and you may not have a bag valve mask. So these are all devices that we're going to use to breathe for somebody. All right, so you're going to do non-stop compressions until someone with more advanced equipment actually comes to help you. Okay, it's not recommended to give mouth to mouth anymore, to actually put your mouth on their mouth. That is a way you could breathe, but it's not recommended. Okay, so let's just keep going a little bit more. So when we are into CPR, we're doing 30 compressions, pressing on the chest. We're going to push hard and push fast, and then we're going to give 2 breaths if we have a breathing barrier. Okay, but if we don't have a breathing barrier, we're just going to do non-stop compressions, circulating the blood and oxygen that's already in their body around, and we're just going to keep compressing, pushing hard and pushing fast until someone else comes and brings in one of these barrier devices to help us. Okay, so then if we look at the information, we see that our adult is 8 years old and above, or we also said it could be puberty and above. And we're going to compress with 2 hands right in the center of the chest, right in between nipple line. Okay, so right down the center and right in between nipple line. We're going to put our palm right in the center. We're going to pull our fingers back and keep our arms locked, and we're going to compress straight down. So totally perpendicular to the body, compressing deep into their chest. Okay, so we're in the center. How deep are we going to go? We're going to go down 2 inches, right, up to 2.4 inches. All right, I know what you're thinking. 2.4 inches. How do I know I'm getting down 2.4 inches? So it's 5 to 6 centimeters, but we're going to get down 2 to 2.4, and that will come with practice. But we want to push hard and push fast, all right? And if we go any deeper than the 2.4 inches or the 6 centimeters, then it can cause more damage to the chest, but without any more benefit. Okay, so we want to get down pretty deep into the chest. So push on your chest right now. Right, how deep does it go in? Not very much, right? Yeah, so maybe 1 millimeter. So when we're doing CPR, we are actually deforming the person's chest. We're going way more than 1 millimeter, right? We're getting down 5 to 6 centimeters, right? So when I look at my fingers, I say, well, this is about a half inch. So if each finger is a half of an inch, I'm getting down that deep. So 2 inches or a little bit further into their body, which is very deep into the person's chest. All right, so then we're going to compress at a rate of 100 to 120. So that's the beat of staying alive. So staying alive, right? That's the beat of staying alive. Or some people are new parents, right? So they're like, baby shark, do 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 do, baby shark, right? So maybe that's your groove, right? Just settle into that 100 beats per minute, right? Or up to 120. Okay, and then you're going to do 5 cycles of CPR when we use the defibrillator. So we'll talk about that. But basically, if you have the defibrillator, it will allow you to shock maybe, and then it will allow you to do 2 minutes of CPR before it wants to shock again, and then 2 minutes of CPR. So it just so happens that 2 minutes is 5 cycles of the 30 compressions, 2 breaths. That's 1 cycle. 30 compressions, 2 breaths. That's another cycle. 32, 32, 32. That's 5 cycles, so that's actually 2 minutes. Okay, so far we don't have a breathing barrier on us, so we're just going to do non-stop compressions, right? We're not going to give any breaths. We're going to do non-stop compressions until the paramedics get there, or our partner comes in and brings us like a pocket mask that we can actually breathe. All right, so I'll show you that. So we're going to take it out of its case, and it comes out pretty flat, so we need to pop it up like that. The one-way valve does come off, so don't let that fall and like land in someone's vomit, because that's gross. You don't want to put your mouth on that. So we want to make sure we hold it as we pop it out. So now our face shield looks like this. Okay, and so it's more pointy at the top and it's more flat on the bottom, so it'll actually cover your face like this. Okay, so your nose is pointy, and so is the point, so the pointy part's going to go towards the nose. And if you do have a head strap like this, you can use it, but it's not enough to actually suction cup this to the person's face. And that's what we want to do. So we still have to seal it down, but it does kind of hold it in place. So if you're going to use it, then you could try not to move their head too much, but you can put it around their face like that, and at least it holds it in place so it doesn't fall off. Okay, but we still have to, when we give a breath, we're still going to secure it down. Okay, so if we look at all those steps, all the numbers, right? The adult is 8 years old and above, 2 hands in the center of the chest, 2 to 2.4 inches, 30 compressions and 2 breaths, only if we have a breathing barrier. And then we're going to be at a rate of 100 to 120 beats per minute, and we're going to do 5 cycles when we use the defibrillator in between the shocks. Okay, so then if we kind of walk through the steps, so first we're going to put 1 hand on the forehead, 2 fingers underneath the chin, and open the airway. That alone is a treatment, right? So maybe they went unconscious, and they fainted, and maybe they're unconscious for some reason, and their tongue falls to the back of their throat. So this person technically is choking. They're choking on their own tongue. But the tongue doesn't like flip back and choke you, right? But it's a muscle, and all the muscles are limp. They're unconscious, so it just falls to the back of the throat because gravity's pushing down, and that will actually block their airway. So by you coming in and starting your assessment by opening up the airway, then that actually is a treatment, right? Maybe they instantly start breathing just when you open the airway like that. This takes the tongue off the back of the throat and allows the person to breathe. So if they could breathe, they would. So when we open up the airway, one hand on the forehead, 2 fingers underneath the chin, we tilt the head back, and we're going to look, listen, and feel for breathing, right? For how long? For 5 to 10 seconds, no longer than 10 seconds. Okay, so that's how we're going to open up the airway and check for breathing. We look at the chest, we hear breath hit our cheek, and we feel breath hit our cheek for 5 to 10 seconds. Okay, and if they're not breathing, that's bad. All right, so everyone say that. If someone's not breathing, that's bad. One more time. If someone's not breathing, that's bad. That's how you can sum up this whole CPR section. So I like to make little things like that just kind of keep things simplified in my mind. If someone's not breathing, that's bad. Start CPR. Okay, so that's what we're going to do. So that's how we open up the airway. And then when we're checking breathing for 5 to 10 seconds, if they're not breathing or not breathing normally, that's bad. We're going to start CPR. And when we give a breath, we're going to give a breath over 1 second duration. Back 10 years ago, it used to be over 2 second duration, but we give a 1/1000, let the air come in, let it come back out, and give a 1/1000, let the air go in and come back out. So we could breathe mouth to mouth, but it's not recommended. But I'll show you how we do it anyway. So if you're going to breathe mouth to mouth, maybe on a loved one, you're going to open up the airway, you're going to pinch the nose, and your mouth is going to go over their mouth, and you're going to give a slow breath in until you see chest rise. Once you see chest rise, you can stop. Okay? We could breathe mouth to nose. So if we breathe mouth to nose, we still have to open up the airway. We're going to close their mouth. We're going to put our mouth on their nose and give our breath in until you see chest rise. Okay? You could breathe mouth to stoma. So you can put your mouth on the hole that's already in their neck. So maybe if someone that's had a past surgery already has a hole in their neck, right? So when I say already, that's not you poking something in their neck, right? Let me say that again. That's not you poking something in their neck. They already breathe that way. Okay, there's already a hole there from past surgery, and that's how they normally breathe. So in that case, you would keep the airway in neutral position, okay, because the tongue will fall to the back of the throat because they're unconscious, so that will block the airway. And you would put your mouth on their stoma, on the hole in their neck, and you would breathe that way. Okay, and then you could breathe mouth to barrier. So you can have you can put your pocket mask in place, the pointy part going towards the nose. You can seal it down, so now the hand that's on the head, right, seals the mask, like almost completely the mask, right? And we're gonna pinch the bottom. So we're gonna seal the mask down, we're gonna pinch the bottom, we're gonna open up the airway, and we're gonna put our mouth on the mask, on our one-way valve, and actually breathe until you see chest rise. Right? So it's always until you see chest rise. When you think about the adult, maybe having bigger lungs, the child a little smaller, and the infant a lot smaller, you're only breathing to the point where you see chest rise. Right? At that point, you know that the lungs are small. Now they're expanding as you're breathing in, and now they've taken up that space between the rib cage, and now the rib cage is moving. And so now when the rib cage is moving, you know that the lungs are inflated. Okay, so that's how we're going to assess whether a breath goes in, and also if we're giving a good breath. So you just want to breathe in slowly into the person over 1 second duration. So it's not a really fast, because you don't breathe that way. You don't breathe, right? You breathe slowly. So that's how we're going to give them a breath. So give them a breath just how you would give a breath. Okay, so that's how we're going to do it. So then we're going to continue CPR until our acronyms stop, until there's spontaneous recovery, right? Or the AED becomes available, the defibrillator, right? So AED stands for Automated External Defibrillator. So whenever you see that, that's what we're talking about. The pads, when you put them on, clear, right, and shock the person, that's what we're talking about when we say the AED, the Automated External Defibrillator. Okay, it's automated, it talks to you. It's external to the body, so it's not the kind that's implanted in the body. This is external, it's up on the wall like a fire extinguisher. And it's a defibrillator. It will reverse fibrillation. Okay, so then we're going to keep doing CPR until we transfer care to the paramedics, right, or the firefighters, or to somebody who comes to the scene. We're going to continue until you just become so exhausted, too tired, that you can't even continue. Right, so what are you going to do? You're going to get back, drink some water, wipe your sweat off, you're ready to go, and get back in there. Okay, and then we're going to keep going until there's physical danger. So if a plane crashes into the building, right, like 9/11, or there's explosions in the room, something like that, if the family members are becoming aggressive and not wanting you to touch the casualty, then in that case, just step back, and the scene has become unsafe. So then you're just going to get out of there, and then call 911. Okay, so that's good. So we're going to keep doing that. And so the compressions only CPR is just what it sounds like. We're going to do compressions only. We don't have a breathing barrier. We're just going to do non-stop compressions, right? We're not going to put our mouth on their mouth or their nose. So those are ways you could breathe, and I taught you that, but that doesn't mean you have to, and it's not recommended to put your mouth on their face. We're going to use a breathing barrier to do it. So we're going to do just non-stop compressions. Okay, so when you think about it, I want you to train up somebody in how to do non-stop compressions. It's really easy, right? If you've taken the CPR class, so what about if you have the cardiac arrest? What if I have the cardiac arrest? I'm the one who knows how to do CPR. So I want you to train up the people around you. So I want you to tell somebody, hey, I took a course of BVD emergency training with Dr. Brock, and he taught me how to train somebody up really quickly. And so I want you to do it, right? So this is what you say. All right, so if I stop breathing, then I want you to call 911. I just want you to push on my chest hard and fast until the paramedics get there. All right? Okay, so that's how quick it is to train up somebody. In compressions only CPR. You don't have to give mouth to mouth. We're going to circulate that blood that's already inside the body, that's already in the bloodstream. So when you think about it, how can someone, if no one's doing CPR, how can there still be oxygen in the bloodstream, but it not be in the brain, and now the person has oxygen in their body, but they have brain damage? Well, it's because you, as a bystander, didn't circulate that blood around and actually build up the pressure high enough to get those oxygens off the red blood cell through the membrane and into the tissue, into the brain, to keep the brain alive. So what we have to do is we have to do at least 11 compressions, enough to be able to build up the perfusion pressure, that blood pressure, that pressure that can get those oxygens off the red blood cell into the tissue to actually keep the brain alive. It takes 11 compressions to be able to do that. So if you think back in the day when we only used to do 15 compressions on an adult, that was a problem, because we used to only do 15 compressions. So we'd give 11 compressions to build up the pressure, and then we'd give 4 good compressions and stop and take our hands off to give breaths, and then the blood pressure will be dropping again. So our save rate wasn't really high, right? But now we actually know that you have to build up that perfusion pressure. So that's why they've extended it to 30 compressions. So there's a research study that looked at 60 compressions, 45, 30 compressions, and they said that 30 compressions was the amount that people didn't get too tired, right? But it was still higher than 11, still higher than 15 that we used to do. So now they moved it up to 30 compressions. Okay, so we're just going to keep going, push hard, push fast, and circulate that blood and oxygen that's already in there. Right? There's 4 oxygens bound on that red blood cell. So we need those 4 oxygens to get off the red blood cell and not be bound and actually get into the brain to keep the brain alive. And we don't even have to breathe for the person, but we're circulating blood around their body. And that's amazing. Okay, so that's our compressions only CPR. So now let me just run it from top to bottom and demonstrate what I expect from you, and then we'll practice.